And with that, we'll move on to approval of the agenda. If there are no changes by anybody, we'll just continue on. We've got next item on our agenda, the approval of the September 14th Management Committee draft minutes. Everybody's received them. Is there a motion to approve?
So moved.
So moved by Lilligren. Is there a second?
Second.
Seconded by Lee. Any further discussion? Seeing none, all those in favor say aye.
Aye.
Those opposed, no. And that passes unanimously. We'll move on to our non-consent business items. Right now, we've got item 2022-252, Metro Gold Line Bus Rapid Transit Cash Flow Financing Plan. And we are bringing up Mark Thompson and Alicia Vapp. And welcome. Thank you for being here today.
Good afternoon, Madam Chair, committee members. My name is Mark Thompson. I'm the Treasury Director, and with me is Alicia Vapp, who's the acting project director for the Gold Line project. And we're here to present business item 2022-252. This business item is requesting council approval of a short-term interim loan to help with the cash flow of the project during a period when there's no other funding available. It's a short-term loan for a 3 to 4 month period and a maximum of $40 million from the internal investment pool to be paid back with interest and when federal grant monies are received. And we have a short presentation to give you a little bit of background on the project and the funding sources and the cash flow. So we'll jump to the presentation.
Thank you. So I'll give a few slides to orient us on, give you some additional background on the project. I know you all have seen updates on this project, but it may have been maybe about a year since the group or the full council has seen an update. So the Gold Line Bus Rapid Transit project is frequent all-day service, primarily operates in bus-only lanes. Our budget is $505 million. It's a 10-mile project with 21 new stations, including stations in downtown St. Paul. We will be purchasing as part of the project 17 new vehicles. So 12 will be diesel, 5 will be electric, and all the infrastructure that goes with those buses, chargers and whatnot for the electric vehicles. We are doing some upgrades to the East Metro garage facility in St. Paul. So we're working with engineering and facilities and bus maintenance on those improvements. This project also includes 3 surface parking rides, 1 parking structure located at the Wooddale Drive station, which is a parking ramp. And then we do have 8 grade separated BRT crossings. So where we are in the project schedule right now, we do have, we have a bidder for our civil construction. So Ames Construction is the contractor that's working under a limited notice to proceed for a small portion of funding to get us started while we're waiting for our funding from the federal government. So we're anticipating our full funding grant agreement sometime in late November. And that is tracking on schedule, as you can see. So I'm gonna move to the next slide. These are all I'm not gonna go through all of these items, but these are the funding sources for the project. There's quite a few funding sources, but the large ones are the Federal Transit Administration at $239 million. And then the 2 counties, Washington County and Ramsey County, which actually make up a joint powers board that provides the majority of the funding, has provided all the advanced funding for the project. So as I mentioned, we're continuing to wait for our full funding grant agreement that's anticipated soon. And so we do have the agreement that I mentioned, the joint powers board agreement, and that allows us to use funding for this early construction activity while we wait for our grant from the FTA. There is a clause in there that restricts their funding. So once we do get notice that the full funding grant agreement is awarded, there's a period of about 3 months where we, per the language in our joint powers agreement, we're not able to use that local funding. And so while we're waiting for the federal funding to come in through the normal grants process, then this is the period that we're requesting the internal loan so that we can stay on schedule with the commitments that we've made for our contractor for the civil construction.
Yes, I'll speak to this slide. This shows you a graphic of the projected cash flow of the project. As you can see, it's projected to have a negative balance or go below zero in November. And in December, we're about 16 million down, January about 25, and February reaches the peak deficit of about 35.27 million. That's cumulative, and then it shows the receipts are expected in March. So like Alicia said, there's about a 4-month period there where we expect to have a negative fund balance where they'll draw upon the loan. And we have a council policy of finance and asset management policy that allows us to do this loan. And it requires council approval of any loan that's longer than 3 months or greater than $10 million. So that's what this business item is requesting. And it will be paid back, like I said, with interest. And so the proposed action, I guess we can go to the last slide, is that the Metropolitan Council authorize the regional administrator to execute a cash flow financing plan for the Gold Line Bus Rapid Transit project. Up to an aggregate maximum amount of 40 million. We added a little bit of cushion in there in case, it's all based on projections, we wanted a little bit of a cushion. From the council investment pool until funds from the associated FFGA are received. So with that, we'll stand for any questions.
Great, thank you. Are there any questions? Councilmember Lilly.
Yeah, thank you, Madam Chair. Mr. Thompson, Ms. Pep, thanks. I have a couple of questions. One is, and I'm assuming we've done this before, right? The precedent is, to the scale, or?
I think the last one we did, Southwest Light Rail, Marie, is that right? Yep.
Okay, cool.
So not too long ago.
Thanks. And then the other has to do with the joint powers agreement between Washington and Ramsey counties. I'm just wondering, is this the only project that is covered under that joint powers agreement, or? Okay, thanks. Just curious.
Councilmember Fair, yep.
Thank you.
Great.
Thank you.
Any other questions? I just had one quick question when I saw the slide, and maybe this is for Councilmember Barber. This is CTIP money from back in the day?
Yes, that
Yes.
is part of, of the
Okay.
funding scenarios, yes.
Okay, all right, that's good to know. I was like, oh, how'd that happen? But yeah, that makes sense. Okay. Anything else? All right, then before us, we have a motion that staff is proposing to authorize the regional administrator to move forward with this $40 million loan. I think it's up to 40 million, is that correct?
Yes.
Sure. So that we can manage our cash flow for the project at the Gold Line. Do I have a motion to approve? So moved by Lee, seconded by Barber. Any further discussion? Seeing none, all those in favor say aye.
Aye.
Those opposed, no. And that passes unanimously, so thank you very much. Great report, we
Thank you, Madam
appreciate
Chair.
that. We now have, our next item is 2022-260 Joint Powers Cooperative Agreement with Washington State Department of Enterprise Services, and we've got Jody Jacoby, Director of Procurement with us today. Hi, thanks for being here.
All right, thanks. Good afternoon, Madam Chair. My name is Jody Jacoby, and I'm the Director of the Procurement Department. And with me today, I have Laura Vetter, who's the Assistant Director of the Procurement Department, and we'll be tag teaming the presentation. So this business item and requested action is really the result of a lot of discussions and a strategic partnership with MTS to provide another tool for rolling stock, which is known as bus purchases, to meet their business needs. And through this staff-led initiative and a lot of thought leadership and looking at the best solution, it actively seeks out an opportunity, a unique opportunity to save time, to save money, and also to maintain compliance with the procurements. And as you know, last week when we were here talking about the very stressed supply chain, it's also important, again, to have another tool to be nimble, to ensure that we have vehicles to operate our service. And with those vehicles, ensuring that we get competition as well. So this presentation will start with a high-level overview of what a cooperative is, the statutory language around it, this specific cooperative, and the action before you to approve the joint powers agreement to utilize it. Next slide, please. So I'll mention first that the Office of General Counsel has been heavily involved in helping us draft this business item and draft this guidance. So what is a cooperative? A cooperative procurement is another tool that can be utilized to satisfy the competitive process. The Uniform Municipal Contracting Law outlines that a municipality, which the council is, may utilize a contract for the purchase of supplies, materials, or equipment. And that's what we're looking at. This specific procurement is for equipment for buses. If the purchase is through a national municipal association's purchasing alliance or a cooperative that was created by a joint powers agreement. And this specific business item references a cooperative that would be created by a joint powers agreement. And again, the statute specifically outlines that we can utilize it. We have to look at the state's cooperative first and then determine if the state's cooperative isn't able to meet our needs. This is yet another tool to ensure we can get the goods to help our business unit move forward. And so for this specific item, the state of Minnesota does not have the buses that MTS needs, larger buses. The state of Minnesota Cooperative does also not have electric buses on their contract. So again, this is just another tool. Next slide, please. Cooperatives really are an effective tool to ensure we're getting the best value in a timely manner with lower administrative costs. And when we consider cooperatives for procurement, we certainly look at and do our due diligence with each cooperative. As you remember at the last management committee, there was a cooperative procurement with Sourcewell, and there was that individual action that they could go right from looking at the specifications or the services right to a purchase order, and that one was for staff augmentation for IS. Some of the considerations that we look at consistently before we use a cooperative, again, it's another tool, is conformance with state law or local law. This specific cooperative, which Laura's going to talk about, is federally compliant, specifically compliant with the Federal Transit Administration. It's also compliant with DBE and Buy America, and Laura will talk about that a little bit. Some of the due diligence that we do is looking at the product or service specifications. We review prices, terms, and conditions that ensure that it really is the best value for the council. We verify application and eligibility to make sure that it's a legally defensible procurement strategy. We compare multiple contracts, and then we have the ability to negotiate with large quantities. One specific area of interest, again, for MTS is they do not buy a lot of buses. And to go out individually for one or two vehicles really isn't in the best consideration for value and time. So this specific cooperative, again, allows them to leverage a national cooperative to be able to get good pricing and get the vehicles that they need. And then the final benefit, or there's many benefits to consider with a cooperative, is if we're having issues with a supplier, we have that ability to leverage a response based on a large order going in. And we definitely have a lot more leverage than just a contract that has one or two vehicles on it. Next slide, please. talked about this a little bit, but just some of the high-level benefits with a cooperative. And again, it's another tool. It's a tool that we can consider using. Sometimes we'll look at cooperatives and determine it's in the best value of the business unit and of the council and the taxpayers to run our own solicitation. But some of the benefits include saving time. It reduces a significant amount of administrative cost. It helps us connect with top suppliers. And then it also delivers immediately a value to the business unit.
Madam Chair and committee members, as Jody Jacoby shared, I'm the Assistant Director of the Council's Procurement Department. My name is Laura Vetter. And I'm going to be sharing some information about why we're looking at this particular cooperative, the state of Washington's cooperative. First, it's FAST Act compliant, which means it's FTA funding compliant. FTA allows an entity to enter into a contract where there's multiple vendors, even if it's in another state. So here we have the state of Washington and the state of Minnesota entering into a cooperative agreement in order to purchase equipment, which is the rolling stock. Let's see. It also, as Jody shared, covers a large variety of vehicle types. These are vehicles we can't get on the state CPV contract, unfortunately. We do purchase small buses, but even at times, sometimes we have issues with availability, with the chassis shortage and part shortages. There may be contracts that are not even available to purchase off of because of the availability. And this contract offers that availability of large buses, electric buses, hybrid, and even charging infrastructure. Competitive pricing, a lot of entities are signed up with this contract. In our own region, Iowa, we know for sure is signed up and purchases off this contract. It also helps save time and staff time and resources. Our procurement action lead time, which is the time of advertisement to award, is averaging 207 days for these types of procurements. So much of this time is already completed and fulfilled by use of the Washington contract. It also is a great research tool. It's a great resource that we can provide to our business units and say, here's 10 electric charging bus contracts. Look at them, you can see the standards and review what the standards are in the industry now, which can help better inform our own procurements. And then the use of the cooperative contracts makes no change to the DBE requirements. As transit vehicle manufacturers, or otherwise known as TVMs, FTA has to certify them that they are compliant with DBE requirements, which happen during the manufacturing process. So by use of this cooperative, we're making no changes to what the DBE requirements are because that's fulfilled during the manufacturing process. Next slide, please. We're asking you to authorize a joint powers agreement. Minnesota statute requires that the governing body authorize all joint powers agreements. And here, this is a joint powers agreement because there are two governmental units, and the state of Washington is considered a governmental unit under Minnesota law, that are entering into an agreement to share the power that they both have, which is to purchase rolling stock. And finally, the proposed action we are requesting and asking that you take today is that the Metropolitan Council authorize its regional administrator to negotiate and execute Joint Powers Cooperative Agreement number 22I002 with the Washington State Department of Enterprise Services to allow the council to utilize their master contracts for cooperative purchasing of rolling stock.
Madam Chair and committee members, we're happy to take any questions that you have on this item.
Great, thank you. Are there any questions? Councilmember Lee.
Thank you, Madam Chair. This might be a dumb question, but so Chicago has buses and trains too. does Illinois not have a cooperative that we might work with? I imagine it might be cheaper to ship buses from Chicago than from Seattle.
Madam Chair, Committee Member Lee, so this is really a very unique cooperative. FTA's language indicates that you can only use a state circular to purchase items off of. The state, we can add the terms and conditions after. So we've been using the state contract because that's what FTA allows. Until recently, where they've collaborated with Washington State to approve this cooperative. So Illinois may be purchasing off of it, but this is relatively a new thought and a new tool that transit agencies, entities like the Met Council can consider with buying rolling stock to leverage the power.
Madam Chair, committee members, another addition that I would add, responding to your question, is some of the manufacturers, they're not all in the state of Washington. In fact, New Flyer, a Minnesota manufacturer, is on the state of Washington's list of cooperative contracts and can be utilized.
Thank you.
Councilmember Lilligren.
Thank you, Madam Chair, Mr. Jacoby, thank you for this work in the report. And I have a question, I just love to understand jurisdiction and how things like that work. And so, do I understand this correctly? We can enter into this joint powers agreement for cooperative procurement with the state of Washington because the state of Minnesota has an agreement with the state of Washington. Is that correct?
Yeah, Madam Chair, committee members, for this particular type of procurement, rolling stock, FTA will allow other agencies, not just a state agency, to enter into those agreements with cooperatives outside the state.
So we're entering into it directly, it's not through.
Madam Chair and committee members, that is correct. We are entering directly into the agreement.
Thanks, and this, Madam Chair, then, just another question about the, I assume from what you were talking, what you were saying is that we have an existing cooperative procurement contract, and that is quite a mouthful to say. Did you say CPCs, is that what you call them?
CPV.
CPVs, okay, thanks. With the state of Minnesota, they just didn't have the stock that we were interested in, correct, and including electric stock and, okay, so it just makes me wonder, you know, we have a state that urges us to electrify our fleet very aggressively, or some legislators that do. I just find it's kind of interesting that they can't provide us the stock, the electric stock that we would need to do that, and I guess that's just a comment more than, it's no question. Thanks, thank you.
Councilmember Lilligren, it's good to keep it top of mind.
Thank
Because we're
you.
chatting with some of our wonderful legislators that are advocating for that. Anyone else have any comments on this? Councilmember Gonzalez.
Just a quick question, again, just to understand the process. So can you just walk us through a hypothetical? Let's say that we need to buy a bus. So what's the next step under this? Do we need to call Washington State and ask for the bus? How's that gonna work?
Yes, Madam Chair and committee members, I'll try to answer as succinctly as I possibly can, although noting that the process certainly has a lot more discussion around it. First, we would work with the business unit to identify their needs and look at different tools and options that we have to meet their needs. So that may be looking at a cooperative that has the type of electric buses they're looking for, but it also may mean researching those contracts to be able to apply best practices to run our own procurement, if that is determined to be the best method. So the first step in the process would be to decide on the best method. If the best method was to go forward this cooperative, a review of all of the contracts to see which one would be the best fit, which one would be most advantageous to the business unit and the region. And then we would go ahead and work with the Washington State's contracting personnel, where they make sure that all of it is FTA compliant, they've done the competitive procurement, and we're starting pretty quickly to negotiate with the bus manufacturer on pricing and availability.
anything else?
Good point.
Councilmember
Madam
Wilson?
Chair, actually, can you help me understand why specifically Washington? And why not other states? So,
Madam Chair and committee members, that's a very good question. So the question was, why Washington? And I think they have taken advantage of the current FTA rules and regulations. They have a high functioning procurement department. So to your point, I think they've just found success in what they're doing and they've really expanded it. There are some other contracts that do have some availability, but this one is pretty large compared to some of the other ones that may be available.
Yeah, and just Madam Chair, Councilmember Muse, to add on to Laura's response, it's really about being strategic. Like we're looking at sort of the playbook or what are all the options, again, considering a very stressed supply chain, considering the knowing that once you place an order, then you get in queue, all of these factors, it's another opportunity for us to help the business units get to delivery of that bus. And we continue to really empower staff, and this was staff and Paul Colton, who's here, he's the project manager in MTS, always just looking for ways to improve the process. We can't change the funding. We can't change the requirements for FTA. But this is something we could do to move forward faster and hopefully get an advantageous outcome. And Metro Transit is also considering it. They're looking at it, and we think it's going to be a great tool even for our staff to connect with other partners across the country to look at their specifications, to find out what real-time pricing they're getting, to see how long it takes for under that contract to build the bus to specifications. So we continue to just go back and look again and think again, using this data to have a better outcome.
Councilmember?
Oh, I'm sorry.
Oh, did you have a follow-up, Councilmember, say, or
No, I'm
Councilmember
good.
Pacheco? Okay, Councilmember Lilligan.
Yeah, thanks. And just for my own education around these cooperative procurement agreements, CPVs. So is this a revenue generator for a state like Washington? Is that, I mean, it sounds like they're setting up quite a business with other transit providers.
Yeah, Madam Chair and committee members, it certainly is a revenue generator for those agencies that have cooperatives. And the council does not pay to utilize the cooperative, it costs the council nothing. In fact, that administrative cost is applied to the bus manufacturers.
Oh, interesting. Thank you. Thanks.
Great, I was gonna ask that too.
Curious, yeah.
You might get wrapped up into the price of the bus, but, you know, that's a whole other.
Yeah, Madam Chair, committee member, it's a similar administrative fee to the state of Minnesota.
Okay.
So that's a consistent commonality with the cooperatives and the pricing structure within it.
Thanks.
Councilmember Robert, do you wanna add anything as our transportation chair?
I'm just very excited about this opportunity.
Cool.
I think this is, we've had some challenges with supply as Jody and Laura alluded to, and this gives us another pathway. So I'm very much in support of it.
And just one question actually for Councilmember Barber, we have our transportation policy work group. We also have, Councilmember Barber and I meet with our, we don't call them suburban transit providers, thank you. And is this what you were referencing in one of our calls with them about the availability of buses and how we're looking to be able to procure like this, that it should not only help us here within our region and Metro Transit specifically, but with our suburban providers as well, I would think, as partners?
Madam Chair, it is connected. One of the things that was mentioned was the chassis shortage, and that this was the specific topic we were talking about was a shortage of some of those small buses through the Minnesota contract, and so this should help relieve some of that.
Good, well, that's good news for everybody. Anything else on this item?
Quick question.
Yep, Councilmember Muse.
So the question is State of Oregon utilizing this opportunity since they're geographically closer and they have a similar governmental entity like McCansell in the region? So wondering if they're using the same tools as well.
Madam Chair, committee members, I am aware that Alaska is using this cooperative, and I will say I'm 90% sure that Oregon is also.
Anything else? All right, I just want to add my comments. Thanks for all the great questions, because you checked off all the ones I was going to ask too. And I really appreciate the hard work and, innovative minds to go out there and look for new solutions, especially when we've got logistics problems and we know we've got pent up demand to do things that we can't be doing right now. And to join up and do something like this to the benefit of our region, I think is great. So good work to the staff on this, and it'll be fun to see the results coming through, and then we can tell our story around the region and to the legislature as well, on how we're trying to push forward, even when times are very difficult to do so within our own current systems. So with that, we've got a proposed action before us that the Met Council authorized the regional administrator to negotiate and execute a joint powers cooperative agreement with the State of Washington Department of Enterprise Services to allow the council to utilize their master contracts for cooperative purchasing of rolling stock. I would entertain a motion.
So moved.
Moved by Barber, is there a second?
Second.
Seconded by Lilligren. Any other further discussion? Seeing none, all those in favor say aye.
Aye.
And those opposed, no. That passes unanimously, so great work, we really appreciate it, and good job for everybody with rolling stock issues. All right, we are now moving on to an item that we are bringing back from a previous meeting that we didn't get to, and that is information on the continuance of our medical and dental rates, self-insurance, and we've got Marie Henderson, our Deputy Chief Financial Officer, to share this information with us. So thank you, Marie.
Absolutely. Good afternoon, Madam Chair and committee members. I am Marie Henderson, and I understand we started this conversation last week, but I would, if you would indulge me, just to let me refresh you with the first couple of slides and then move on.
Perfect.
So the reason why we bring this item here to management is to get a general concurrence around a recommendation about our premium rate setting for our medical and dental insurance. And today what I'm focusing on is the total premium for the employee and the employer shared together. The premiums are set at the bargaining unit level, and they are different for each of our unions. This slide is the summary then of what is our projected healthcare benefits and what do we need to cover. So, it's math, but it's very complicated math. We actually employ actuarial Aon to do this actuarial study of what are we projecting for our plan costs. This includes the added impacts of COVID. What's the capacity on our system? What's vaccinations going to be costing, and testing, and direct COVID costs, along with people that are deferring their health care. They look at claim experience for the last 24 months, medical claims, medical trends, pharmacy rebates, plan experience, administrative costs, and really more importantly right now, inflation on all of this too. There's multiple actuarials periods that we use. We just don't look back 12 months, we look back 24 months to try to take out that volatility and to project year over year. We are projecting that our cost needs for this fund is $3.4 million above last year, which is $83.4 million for our costs. And we're also then projecting that to be covered by the premiums, both the employer and employee side. That's $75.6 million. It's down $500,000, and I'll explain that a little bit later, but mainly we don't have as many employees covering that premium, and costs are going up. So when you do all that math, it's a 10.3% increase, which is larger than what you've seen before in the past.
Madam Chair, just on that, I want to make sure that I'm understanding this before we go on. So, but the actual increase of or projected premium cost is only like a 5%, right? It's these other economic factors that we have fewer people paying and push it up to 10. But the increase was just 5%, right?
So Madam Chair and Council Member, overall, we set our premiums to match our costs. And what we're saying is that is a 10% increase across the council.
Right.
The medical trend rate is around 7.5% to 8%. And I do have a slide later on
Okay, perfect.
that we
Thank
are showing that why we're above that.
Thank you. Thank you.
And just to follow up, because I want to make sure I'm tracking right. So again, the 10.3 is the big number, but that might break down individually because we have less people paying into the big number?
Right.
Right.
And I will break that down even further
Okay.
by plan as we go through these slides.
Perfect.
Madam Chair.
Thank you.
So I just want to refresh, I'm sure you saw this slide last time too, that we have 3 medical plans here at the council that is offered for both employees and retirees, early retirees. Open access is a plan that is only available for ATU members and early retirees. Distinctions and Power HRA are 2 plans. One is a high deductible plan, which is the HRA plan, and the other distinctions is you have higher premiums in your paycheck and pay a copay, still with deductibles though, that are available to all employees, including ATU. So when we set the premiums, we've been self-insured on medical since 2013 and dental in 2014. And we set some guiding principles of how do we set our rates here at the council every year. And we have 3 setting rate principles that we abide by. And the first one is that the premiums for each of these plans are shared by those enrollees within the same plan. So let me give you an example in the breakdown of that. Like I said earlier, the total gap is 10.3%. Open access is 8.6% of that. And distinctions and HRA are very similar plans in many ways, and we actually pool those together. So if you're in that plan, the premiums and the costs are together for distinctions and HRA, and like I said, open access then is separate. So when you break down that gap of that 10.3, 8.6 is open access, and distinctions and HRA is actually a 10.9% increase. So then when we look at our rate setting principle number 2, that each premium and each individual plan should be evaluated annually and collaborated to project the claims expenses of that plan. So we need to consider kind of actuarial value of the benefit plan. We need to consider HRA costs. HRA is a high deductible plan, but the council puts in basically to cover the premium or the deduction piece for the employee. And just to remind you, on the 2022, the council contributed $3.5 million between single and family to cover the high deductible. And in 2023, we're projecting about that 3.5 also. So not a lot of difference between people migrating from one plan to the other. So again, when you break that out, we have that funding gap of the $7 million being the 8.6 just to open access, because again, containing each of the plans within each group, and then distinctions and HRA covering that 10.9%. So then, what's really important to, I think, employees and staff is to look at this. Again, I want to remind you that this is total premium, employer and employee, and this was the 2022 rates, and putting that side by side then to the 2023 proposal of rates for open enrollment here in October for the employees. Again, the employer or the employees are going to have different experiences because of their different plans. I will say, as a general rule, singles are at 90-10%. So employer will pick up 90% of this cost, and employee will pick up 10% underneath singles, and family, as a general rule, is 80-20. A little bit more palatable when you look at it that way. We are self-insured. Like I said earlier, we've been self-insured on our medical since 2013 and our dental in 2014. We do not use reserves for setting our rates. Our rates are contained within our costs. What we do use reserves for is medical expenses throughout the year are not equal, and we use it for cash flow purposes. And we also we use it to mitigate some of the times when we have more expenses in our costs that we didn't anticipate with the premiums being set the way they were. We do on very large claims have a stopgap loss of $750,000. We've had to use that this last year. So it's a good insurance to have. We have raised that from last time, I believe it was it $500,000? So that's part of what we do with our rate setting principle number 3, is that we maintain a minimum reserve balance to anticipate those one-time extra costs and for cash flow and to avoid the risk.
And that reserve balance is within this entire fund.
The reserve balance is broken out, Madam Chair, between medical and dental. We have
Yes.
2 separate reserve balances,
And
but
it's
it's contained in its own fund.
Okay, thank you.
To just give you an idea of enrollment, because the premiums went down, our enrollment across the board are down, which makes sense because our employee count is down. Just to kind of give you an idea of a visual there. And as we talked about earlier, I know this is a really small slide. The blue line, kind of the one in the middle that's been stable across, is our medical trend rate, which has been around that 7.5. It's really more trending up more towards 8%. You'll see probably by next year. You'll see the red line is our HRA and distinctions plans. In 2020, when I was in front of you, and we were looking at what's gonna happen, we didn't know, we set our rates as flat year over year for the employees. That is why it's at 0% there. Great decision on the plan, maybe not, but in hindsight, it was the best thing to do at the time. And then you'll also see the green line for open access. The good news here is, since we've been insured, we've only crossed that medical trend rate once a little bit in 2019. If I went back to 2013, we never were above that rate. This year, with inflation of all the other factors, we are above that medical trend rate. But overall, for premiums and what employees will be paying is really market-wise lower than even other industries. Talking a little bit about our reserves and the reason why we use it. I think what's really important on this slide is look at the actuals of 2020. We had reserves of $43 million over, and within 2021, we used $7 million of that because of claims that we didn't anticipate being so high. We do anticipate that that may even happen in 2022. It's forecast up there based on our budget, but when we look at, we're about 10% higher. We'll end the year over our claims from anticipated setting our rates for our premiums. So that number will see go down. Dental, I didn't show you any rates or where we're at because dental is still really a good story. Haven't really utilized it in 2020 and we're setting the rates exactly the same as they were for 2022 for 2023.
Just a quick question on that, if I may. And we're up to 5
million
projected.
Just staying flat. If we keep our premiums flat, our reserves would stay flat.
Okay.
That is it. If you have any questions on our self-insurance plan.
Are there any questions? Anything at all? Councilmember Musa?
Only one half, Maria, it's comparing to other similar entities. Are we providing really similar, better healthcare plan to our employees? So just give me, estimate of that.
Can I phone a friend?
Yeah.
On actual, with other entities and medical plans and how we see what we offer compared to other entities.
Welcome.
Chair, council member, are you asking about our claims or our premiums?
The premiums, the healthcare in general.
Are we
So
competitive?
if I'm in staff, I wanna, compare our healthcare run to Henry County, how we fare in that.
Ms. Chair, council member, we compare pretty well. We do, we're probably, if you're a state employee, your premiums are gonna be lower. But compared to other public sector organizations, we do very well.
And I'm just guessing, I should never do that, but compared to private sector, probably
Yeah,
very
you'd
well.
be very correct on that.
And I think that's when we talk about some of these vacancies that we have, and we talk about the hourly wage, which is super important, but the benefit side of things that people might not really know about, and I know we lead with that, and we were talking about in another work group, how are we marketing all this? Had a wonderful presentation, Marcy, you were part of that, and yet, our benefits package is so good, and that hits a family or a person's bottom line, just like anything, especially if they have some issues, so I continue to say lead with that when we're doing our recruiting.
Especially in this, tight labor market, it's an incentive to attract the talent and, thank you.
Any other questions? Oh, Councilmember Gonzalez.
Thank you. Just a quick one and then another more convoluted, I think. The quick one is, do we have a insurance plan administrator, even if we're self-insured? Or we do the
So-
paperwork ourselves?
Madam Chair, committee members, yes, Health Partners administers the claims for us.
I kind of knew it, but I kind of forgot about it. And the other question is, I'm just looking at slide 12 about the medical trend rate increases. I'm just trying to understand the chart here. So the blue line is the overall trend regarding price increases on medical services or medical costs overall. And then the other colors are depending on the specific plans.
Right, Madam Chair and committee members, this is showing medical trend rates and costs. And so again, we set our premiums to cover our costs. So our costs have been very low compared to the national averages of medical trends up until this year.
Thank you.
Okay, I'm gonna ask a question, because so we have less employees, right? I don't know, in each division it varies. So we're covering less employees than we have in past years. So again, explain to me how that's impacting that overall growth in the expenses as it relates to the total premium.
Madam Chair, committee members, that's a really great question. So when you look at that at first and say, well, we have less employees, we'll have less costs. Why is this going up? But medical trend costs have actually increased faster and are larger than our loss of employees. And
So that's
covering
the
premiums.
equation setting, that's the
Yeah,
differential.
It's not a complete balance.
Right, okay, so that helps me to get the visual in my head, okay, great. Anything else on this? Councilmember Muse?
Is that cost of increase due to COVID crisis or other factors?
So there's a lot of factors of reasons, Madam Chair and committee members, there's a lot of reasons why COVID costs. Just inflation, the cost of supplies, equipment, probably paying for your personnel of medical, nurses, doctors,
Okay,
lots of expenses.
thank you.
And I'll just add to that point, the fact that we've got, I think, a fairly low ceiling on the max payout for the employees per year is another layer of protection that the council steps in. So, we wish good health on everybody, but, in those instances, again, I think we compete pretty well in the marketplace. All right, anything else? All right, awesome. Thanks for your patience while we brought you back. Super great presentation. Is there anything else that should come before the committee? All right, without objection, this meeting is adjourned. Thank you.
Presentation.
Thank you.
Oh, yeah. Thanks. It's just